Again, we have Dr. Shahab in the room with us here in Regina. He's the Chief Medical Health Officer for the Saskatchewan Ministry of Health. And on the line, we have Dr. Khami Chokani, Medical Health Officer for the Saskatchewan Health Authority in Prince Albert. Spelling of Dr. Chokami's name is first name Khami, last name Chokani. We'll start with an opening statement from Dr. Shahab.
Thank you. So, good afternoon. I'll just provide a summary of cases to date, and then I'll ask Dr. Chokani to speak specifically to an investigation he's currently conducting. So, as of March 28th, the province of Saskatchewan has 30 new confirmed cases of COVID-19, bringing our total to 134. As of yesterday, number of individuals hospitalized remains unchanged at 6, 1 in acute care in the north, and 1 in Saskatoon, and 1 in Regina, and 1 in the ICU in Saskatoon, and 1 in Regina. We have at least 7 cases resulting from local transmission. The rest are all either travel-related or their household contacts, or related to mass gatherings, conferences, other events. And we've had now 3 significant events with secondary transmission. Of the confirmed cases, there are 5 under the age of 19. All the other cases are adults, 58 in the 20 to 44 age range, 49 in the 45 to 64 age range, 22 in the 65 plus age range. 57% are males and 43% females, and all this information is now posted online. We have an additional person who has fully recovered, so 4 out of our 134 cases are recovering. So again, this is important to recognize that most cases are mild, and many we anticipate will have a full recovery after 2 to 3 weeks of symptom onset. To date, 8,248 tests have been performed by the Roy Romanov Provincial Laboratory. This figure ranks Saskatchewan number 3 in the country for testing of COVID-19. Our intention is to continue with an aggressive testing strategy to stay on top of case contact investigations, because these 2 elements are crucial to prevent further transmission, in addition to social distancing and other measures that all of us must observe. In the days ahead, the Ministry of Health will deploy additional staff to the Saskatchewan Health Authority to assist with contact tracing, to make sure that cases and their contacts are followed up in a timely way. Now I will ask Dr. Chokani to provide a bit more detail as the Medical Health Officer investigating the Christopher Lake Snowmobile Rally dinner held on Saturday, March 14. Dr. Chokani, over to you.
Thank you, Dr. Shahab. Good afternoon, everybody. We became aware of an attendee at the Christopher Lake Snowmobile Rally supper on Saturday, 14th March, testing positive for COVID-19 on the afternoon of Wednesday, March 25th. Since then, we have interviewed this person to gather information regarding where they could have contracted COVID-19 from and the person the individual had close contact with since the possible exposure date. This list has been compiled, and contact with the persons on this list is already underway. Those experiencing symptoms have been or are being scheduled for testing. All persons that attended the rally supper are asked to self-isolate for 14 days from the date of the rally on March 14. This is extremely important to help contain the spread. If you attended the rally and have not yet been contacted and are experiencing symptoms, please call Healthline at 811 to be assessed. Once you are assessed and they determine that you will need to be tested, your information will be passed onto a local testing site or primary health care clinic to schedule your appointment. We have learned that in addition to the 2 positive individuals that we identified, there were 3 other individuals who were symptomatic already in attendance and who have subsequently tested positive. We have to date had contact with 76 individuals, and we currently have 18 cases associated with the Christopher Lake Snowmobile Rally Supper. Thank you.
Thank you, Dr. Chokani. So I'll just complete my remarks and then we'll open it up for questions. So as Dr. Chokani described the event and the investigation, this really demonstrates why we have been reducing the size of gatherings in Saskatchewan and why we really emphasize that while we love celebrating and getting together in Saskatchewan, this is not the time. This is the time for social distancing. This is the time to remain connected through other means, but really not get together as groups to have a meal or share a meal or have events where you are closer than 2 meters and are touching things that are passed back and forth. But I do want to emphasize that COVID-19 continues to present as a mild illness in the majority of cases. Because we have community transmission, we should take care no matter where we live in the community. Wash your hands often. Only go shopping if you're well. Go and just purchase your essential supplies and wash your hands when you come back. Don't touch your eyes, nose, or mouth while you're out and about. If you have any symptoms, fever, cough, isolate yourselves immediately. It doesn't matter if you have traveled or not traveled, if you have been to any mass gathering or not. If you develop symptoms of fever and cough, isolate yourselves, stay at home, separate yourselves from your household members, call Healthline for advice. And we really need to now observe this for the next few weeks in order to flatten the curve. And like I said yesterday, remaining physically distant does not mean remaining socially disconnected. Reach out through other means. Stay in touch with family and friends. Support members in your household. Support your neighbors by doing shopping or running chores for them, but leaving groceries in a safe manner. And, that is the way that we will get over this. So with that, I'll open it up to questions.
Thanks very much, Dr. Shahab. Operator, do we have a question on the line?
We have Stephanie Davis with CTV.
Yes. Are there any guidelines or rules that people coming into Saskatchewan from other provinces should be following right now?
Thank you, Stephanie. So as you know, anyone coming from overseas now has to isolate themselves at home for 2 weeks. So that means you have to stay at home for 2 weeks, even if you're asymptomatic. If you become symptomatic, you should isolate yourself within the house from other household members and call Healthline for further advice. You should not go shopping for those 2 weeks if you come from overseas. You can go to your backyard, or if you're totally asymptomatic, go for a solitary walk. But don't go to places where you are touching surfaces others will touch, like doors or elevators in public places. So that's the guideline for international travelers. We did have a caution for persons coming from other provinces showing COVID-19 cases, for example, BC, Alberta, Ontario, Quebec. Now, really, since we have community transmission, we need to, it doesn't matter if you're coming from another province in Saskatchewan or whether you live in Saskatchewan, we need to be watchful and vigilant of our own symptoms. We need to maintain social distancing at all times and isolate ourselves from our own household members. And if we are essential workers, flag that for our employer if we get symptoms and seek direction from Healthline.
Stephanie, do you have a follow-up?
Yes, just one more. Is the province putting any plans in place to set up drive-through testing?
So we will provide a comprehensive summary of how many assessment centers are now available in Saskatchewan on Monday. There various options are being considered to streamline testing, and as you know, our testing numbers are third highest in the country. So I don't have the specifics of any plans of drive-through that are being used in maybe another province or 2 provinces and in some other countries, but we'll provide an update on Monday.
We'll take our next question from the phone line. Operator?
We have Mickey DeJuric with Global.
Hi, this is Mickey from Global. Sorry. This is the most reported cases in a single day as of yet. Does this set us back in flattening the curve, or what happens now?
So that's a really important thing to understand. So till 2 weeks ago, most of our cases were either travel-related or related to household transmission in those travel-related cases. So we could identify the chain of transmission, and that's good. While we remain concerned with travel-related cases, and while we and the Government of Canada has now made it mandatory to self-isolate for 2 weeks, we feel that if people who are coming back to Canada observe those protocols, we can reduce further transmission. Secondly, we now have 11 cases linked to an event in Edmonton, at least 3 cases linked to a conference in Vancouver, and now 18 cases linked to an event in Christopher Lake. So these are cases linked to a group event. So we can still identify the chain of transmission. We can account for those cases. Of the remaining cases which are under investigation, we now have 7 cases throughout Saskatchewan, Regina, Saskatoon, rural central areas, rural northern areas, where individuals have presented with a cough and fever, have been tested for COVID-19, are positive for COVID-19, and did not travel anywhere outside Saskatchewan in the last 14 days, did not attend any mass event. So here we cannot find the chain of transmission, and hence we are now saying that we have community transmission established. But further to your question, because 30 of the new cases, of those 16 were part of the rally in addition to the two identified early, the Christopher Lake Snowmobile Rally. The other cases are around 12. So that kind of explains that while it's a big jump and it's always concerning, at least we can explain 16 of those cases.
Mickey, do you have a follow-up?
Is there a window to narrow or flatten the curve, getting less and less as the days go by, or are we working toward the goal? Where are we in terms of our projections and goals of flattening that curve?
Yeah. So, our case numbers continue to rise. We are tracking our case numbers, or both in terms of total case numbers and case numbers per million population compared to, for example, Alberta and BC. So our rate in terms of case numbers is actually going up, similar to Alberta. Our total case numbers are 1/4 of Alberta because we have a smaller population. And secondly, we were always predicting that while initially all the cases we were expecting were travel-related, now we are seeing, obviously cases linked to group events and cases linked to community transmission. In order to flatten the curve, we need to obviously do 3 things. One, I talked about what people who are coming back to Canada need to do. Secondly, we have significantly restricted the size of any gathering to 10, down from 250 to 50 to now 10. But even if you have a gathering of 10, even there you have to maintain that 2-meter separation and not share food, not have a gathering where there can be risk of community transmission. So even if we get together as 10 people in a work setting or in another setting, we still have to maintain that social distance. And finally, for the next little while, we really need to be very disciplined about keeping ourselves healthy. If you're out shopping, washing our hands before and going out and after coming back, and also, maintaining that social connectedness but physical distance with our friends and family who don't live in the same household.
We'll take our next question on the line. Operator?
We have Lynn Giesbrecht with the Leader Post.
Hi, Lynn Giesbrecht here. You mentioned new staff being sent to help the SHA with contact tracing. How many staff are you sending, and is there a difficulty in keeping up with all the contact tracing?
So I'm very proud to say that our public health colleagues, medical health officers, public health nurses, public health inspectors, other staff in the SHA and in Indigenous Services Canada and Northern Intertribal Health Authority have kept up to speed and have done 100% contact tracing. That is fantastic. We do realize, however, that as our case numbers rise, it does become harder and harder to do, because what you have to do is when a case is reported, you have to interview the case several times, to see what was the story in the 14 days preceding. And then if there's a group event and dozens of people are named, you have to follow up with each person. If a person didn't really go to a large event, you still want to understand how many people was that person in contact with, call them. Testing has to be done, so 8,000 tests done to date. The test results have to be, the people who are tested have to be informed whether the test is negative or positive. And if positive, then the whole contact tracing starts with every new batch of cases. A lot of this does not require people to be physically present where the contacts are, but we do need to train additional people to help public health colleagues to, make the telephone call to give test results, to, do that contact trace questionnaire. So that kind of work can be done over the telephone, and we really need to boost the capacity of the Saskatchewan Health Authority and Indigenous Services Canada and NITA to really be able to complete case content investigations in a timely way, because that is essential to make sure that any case who is symptomatic is tested and is isolated, and any contact immediately goes into self-isolation for 2 weeks. If they complete the 2-week period, that's fine. If they develop symptoms during the 2-week period, they then need to isolate themselves further within their home and seek further advice from Healthline.
Lynn, do you have a follow-up?
Yeah, so how many new workers are being added to that?
We will start doing an assessment with our partners. Regina and Saskatoon were already expanding their capacity. They were reaching out to health sciences students, medical students, other individuals who at the moment obviously can't go to class or can't work on the medical floors. But we really need to supplement that capacity throughout Saskatchewan. So we don't have an exact number, but I fully expect that number to keep increasing and expanding to meet the needs.
We'll go to our next question on the line, operator. Do we have another question on the line? Sounds like we're having some
Go ahead,
time.
Alicia.
There we go.
Hi, can you hear me now?
Yes, we can hear you, Alicia.
Okay. So knowing now that you've had this many cases from one event where there are more than 100 people, do you now believe that stricter limits on gatherings should have been implemented earlier?
I think we really were leading in terms of limits on gatherings, and really, in hindsight, you can say yes, maybe, but really, we started seeing our first cases travel-related about 3.5 weeks ago. So we think we're trying to stay ahead of the curve. But having said that, I think going forwards, we need to be extremely vigilant, not just in even small gatherings in terms of still keeping that physical distance, but even in our day-to-day activities, whether they're social or whether they're, for those of us who are essential, when we go to work, we either need we need to practice that social distancing.
Do you have a follow-up, Alicia?
Yeah, I mean, are you expecting a spike now in new cases from community transmission through those people at the snowmobile rally? I mean, how much of a spike, if that is the case, and is the risk higher in any individual community in Saskatchewan, like places that are close to Christopher Lake?
So public health is continuing to investigate all the people who attended that event, and the Saskatchewan Health Authority, and we have that link on our website. There's a number you can call. If anyone went to that event and weren't contacted by public health, they can call Healthline for further advice or the public health office in Prince Albert. But we have to understand that the rally happened on the 14th. By the 29th of March, anyone who went to that rally, if they're completely asymptomatic, they are fine. But if people even now develop symptoms, day 13, day 14, they must call Healthline and seek further advice.
We'll take our next question on the line, operator.
We have Connor O'Donovan with Global.
Hey, I'm just wondering, forgive me if this information's out there already, how many people total were at that rally, the snowmobile rally, and how many, can you go over again how many you've tested and how many are left to be tested, if you can reach everybody?
So Dr. Chokani, I'd like you to maybe speak to that if you can. Did you hear the question?
Operator, do we have Dr. Chokani on the line?
Hello, can you hear me now?
Yes, we can hear you now, Doctor.
Thank you. At the Christopher Lake Snowmobile Rally, there were around 250 people. From that, there was the Snowmobile Rally Supper, at which there were around 110 people. Unfortunately, we do not have a comprehensive list, and thus that was why when we did identify the positive case on the afternoon of the 25th, we managed to at least get some initial contacts. And as Dr. Shahab mentioned, that is the importance of contact tracing and doing it in a timely manner. And thus the importance of people who did attend the rally supper to call and let us know, because we need to fill in the gaps.
Connor, do you have a follow-up?
Yeah, I think it was March 13th when the province limited gatherings to 250 people. So I guess I'm just wondering if that gathering is being looked at as a violation of that ruling, seeing as it happened on March 14th.
We will follow up on that to confirm the dates and when the information went out.
And Connor, just to clarify, I believe it was announced on March 13th, effective March 16th.
Oh, okay, thank you.
Operator, do we have a question on the line? Operator, is there a question on the line?
I just want to maybe make a few statements that, we have to be in this together. And I think we need to be very careful not to assign blame to any event. I think no one wants people to come to an event and get sick. And so I think we need to be very careful about that. I think we need to be supportive of people who either were at an event and are sick. We need to be supportive of people who are there and are waiting out the 2-week period. Obviously, we need to maintain our physical distance, but be supportive in any way we can otherwise. And even event organizers, it's a very stressful time for event organizers. Many have had to cancel their events. We can't predict when we will get back to normal. Will it be in the summer, in the fall? So I think it's a difficult time for all of us. We love in Saskatchewan to get together. This is not the time to get together, but this is also the time to support people who find themselves in this position, both organizers of events and also people who were at those kind of events. Thanks.
Thanks, Dr. Shahab. Operator, do we have another question on the line? We have time for about 3 more.
We have Evan Radford with CJME.
Yeah, hi, Dr. Shahab. So given that these restrictions on the amount of people gathering came out and were in effect on March 16th, is it surprising or unsurprising to you that we're seeing these numbers from the curling Bonspiel and also at Christopher Lake? And was this planned for in your modeling of how you and your colleagues predicted and modeled how many people would be infected?
So as we have seen from Europe and as we have seen from the U.S., from other provinces and now in Saskatchewan, COVID-19 moves fast and we cannot be complacent. And 3 weeks ago we were at a certain place. Every week we have tightened our restrictions. We are in a very different place now where only people whose jobs are essential for healthcare, fire, police, emergency services, grocery stores, trucking, other essential societal needs, only those individuals are going to work. Everyone else is at home. We are not encouraging any gatherings and have a limit of 10, but even there we are saying do not share items that can transmit COVID-19. So we are in a very different place. But obviously we still need to maintain that discipline because each one of us has a role. Failing to observe that at an individual level adds up to cases. We need to observe that discipline. It doesn't matter if you're coming to Canada from overseas, if you live in Saskatchewan, if you're traveling from another part of Canada. And we really need to, all of us need to individually and collectively do the best we can to keep the curve as flat as possible. So it's hard to make predictions. Obviously, modeling estimates give worst case, medium, and best case scenarios. We'll be presenting our refinements of those models in future opportunities. But I think we have to aim for the best case, and that comes to all of us individually, doing what we can to maintain that physical distancing.
Evan, do you have a follow-up?
Yeah, I do. The Globe and Mail is reporting today we have tested 641 people per 100,000. Dr. Shahab, do you think this is enough? And what is an ideal number for a province of our population to be testing when we talk about those per 100,000 ratios?
So we actually incidentally just did some calculations this morning. And so if we look at Canada and Saskatchewan, our test numbers performed per million are 6,980. So according to our calculations, those are 698. Those are 698 per 100,000. So probably near to what your measurement was. And these are the third highest testing rates after Alberta, which is highest in British Columbia. So I think we are very proud of our partners in Roy Roanoke Provincial Lab and all our partners who are running assessment sites, primary care physicians who are testing that's happening in long-term care, acute care. This has been happening for the last 4 weeks. So, we're very proud that everyone is playing a role in testing people when they need to be tested. And we need to continue to stay ahead of the curve in terms of testing anyone who needs to be tested. First of all, doing that assessment, the self-assessment tool, the evaluation by Health9, and then determining who needs to be tested, testing them in a timely way. But as individuals, we need to step forward if we have symptoms, make that call, self-isolate ourselves. Even if you get tested and the results come 3 or 4 days, those 3 or 4 days are critical. You have to self-isolate yourselves at the first sign of symptoms. If after 4 or 5 days your tests are negative, and as you can see, out of the thousands of tests done, 134 are positive, the rest are negative, then you are, as long as your fever is settled, you can go about your daily business. But you have to isolate right at the start of symptoms. You cannot go around business as usual till you get your test result back. And I think those steps are essential to make sure that we minimize further transmission.
We have time for 2 more questions on the line. Operator, do we have a question?
We have John Cairns with the Battleford's News Optimist.
Thank you. Can you hear me?
Yes.
Okay. The question I have, I'm just curious if we have any cases in the Battlefords where we're contending with all kinds of rumors and speculation about whether or not there are any cases in our community. I'm just wondering if you have any details about our community that you'd be able to share.
I'm aware of 1 or 2 cases in the PA Battlefords area, 2 cases of community transmission. I don't have an account of cases in travelers. We do have those north, central, south, and you can look online on that data. But we have to remember 2 things. COVID-19 could impact any of us. It could impact someone who's a healthcare provider. It can impact someone who's recently come back to Canada, someone who works in Saskatchewan, someone who came to visit from another province. We have to be very careful about respecting the privacy of individuals who test positive. We want to make sure that people feel comfortable stepping forward to get tested and give a lot of their history to public health in terms of conducting the contact investigation. That's done very confidentially. And it's not helpful at all now to know where those cases are in terms of communities because the risk really is everywhere. And we cannot make any change in behavior depending on are we in this community or that community. I cannot emphasize that point enough that we cannot use testing numbers or testing locations to guide our behavior. Our behavior has to be same no matter where we are in Saskatchewan.
Do we have a next question on the line, operator?
We have Tina Monteleone with PA Now.
Hi, I just need some clarification first. Is the total number 18 or 20 from the snowmobile rally of cases?
Dr. Chokani?
Yes, the total number as of midday today is 18 that we have as positive.
Okay. And then I understand that the boundaries have changed as far as the areas. Can you just confirm if Prince Albert is still a part of the central or northern part of the boundary map?
We will get that clarification. I don't want to make a guess, but we will get that clarification for Monday.
Okay. And do you know if I understand that there was work being done to potentially set up a testing lab in Prince Albert that would be able to confirm cases. Where are you guys on that?
Dr. Chokani, do you have any information on that you can give today? Otherwise, we'll provide a comprehensive summary of testing sites on Monday, but I'll just want to ask if you had any information.
No, I think we'll wait until Monday.
Okay. Thanks very much, everybody. That's all the time that we have for today. Thank you, Doctor.
Thank you. Okay, thank you, Dr. Chokani.